CVS, one of the country's largest pharmacy chains, is banning the sale of cigarettes and tobacco products at all of its stores.
This morning, the White House is applauding the move. In a just-released statement, President Obama says CVS Caremark sets a powerful example, and today's decision will help advance my administration's efforts to reduce tobacco-related deaths, cancer, and heart disease, as well as bring down health care costs.
Tobacco use is the #1 cause of preventable death in the United States. The government says it kills more than 480,000 Americans each year. Larry Merlo is president and chief executive officer of CVS Caremark. He joins us for an interview you will only see on CBS this morning. Welcome.
Good morning, Charlie.
I mean, obviously this is a health question for you, but tell us more about why you made this decision now.
Well, Charlie, this decision really underscores the role that CVS Caremark is playing in our healthcare system. And, there's a growing focus and emphasis on healthy outcomes, managing chronic disease. And by the way, about half of all Americans today suffer from one or more chronic diseases, as well as a focus on controlling and reducing healthcare costs.
And what does it do to the bottom line of the company?
Well, we generate about $2 billion in tobacco and related sales, but at the same time, we believe this is the right decision for our company. It positions us for future growth and the opportunity to play a bigger role in our evolving healthcare system.
I want to get to that, I mean, what it means in terms of the health of people, but $2 billion in revenue that you're going to lose. How do you justify that as a business?
Well, Norah, it's my job.
Stockholders.
Yeah.
Well, it's my job as the CEO to ensure that we're positioning the company for not just short-term success, but for long-term success. And we're evolving into more of a healthcare company, and we're doing many things. We have 26,000 pharmacists and nurse practitioners who are helping millions of patients across the country every day manage conditions like high blood pressure, high cholesterol, diabetes, all conditions whose effects are worsened by the impact of smoking.
But was everybody on board, Larry, when you first presented this, or did you have a couple of people say, look, we're talking $2 billion here, are you sure?
Well, Gayle, we had a lot of discussions among our management team, and I think everybody came to the right decision that it's a real contradiction to talk about all the things that we're doing to help people on their path to better health and at the same time sell tobacco products.
Have you heard from other pharmaceutical executives, drugstore executives?
Yeah, I have not, and I think those competitors will have to make their own decisions. I would hope that they would look at the role that their pharmacists and pharmacies are playing and do what we did in terms of look in the mirror, ask those questions and hopefully make the right decision.
Was it a personal issue for you or a family member? Because so many people today will say, thank you for doing this, and others will say, what the heck are you thinking?
Well, Gayle, it's a very interesting point. I myself am not a smoker. My father was a smoker and died of cancer at a young age. But, as we've talked to people over the last 24 hours, I have been struck by how many individuals have a personal story about a loved one or a friend, a family member, who suffered from the ills of smoking. And as you know, Charlie, as you mentioned, it continues to be a leading cause of illness and death in our country.
Some might ask, why didn't you do this earlier?
Well, Charlie, it's an interesting question. I think the important thing is that we've made that decision now, and we're the first national pharmacy chain to say that we're changing.
The Journal of American Medical Association has a report out about this, about ending tobacco products in pharmacies, that this is one of the leading ways you can actually get people to stop smoking is reduce the availability. We know taxation works, and this is another area.
Norah, you're absolutely right. And I think the interesting point here is that 7 out of 10 smokers say that they want to stop. Yeah. And about half attempt to quit each year. And in the spring time frame, we're going to be announcing a national smoking cessation program across all of our CVS pharmacies and Minute Clinics. And we want to help those people achieve that goal and help them on their path to better health.
And your reaction to the White House putting out a statement applauding this?
Well, we think that's great. And I think that there are a lot of interest groups out there that will be very supportive of this decision.
Congratulations. Thank you for joining us.
Thank you.
Thank you, Larry.